A tracheal T-tube is an artificial stent made of silicone. It is shaped like the letter T. The tracheal T-tube is open at both ends. It has a limb which extends from the tube through the tracheal wall and out through the skin. A tracheal T-tube maintains an airway in the trachea while providing support to the trachea. The tracheal T-tube is intended to be used with a cap over the outside limb. Breathing is done through the upper and lower limb of the tracheal T-tube. When breathing in, air travels from the nose and mouth down the respiratory tract through the upper and lower limb of the tracheal T-tube and down to the lungs. When breathing out, air travels from the lungs up through the lower and upper limb of the tracheal T-tube and out the nose and mouth. Uncapping the outside limb is usually only done to suction the tracheal T-tube. Tracheal T-tubes are often utilized in patients with stenosis of the airway. This is a condition in which the airway is narrow. These conditions include tracheal stenosis, subglottal stenosis, and laryngotracheal stenosis. Also, tracheal T-tubes are mostly used shortly after a person's trachea has undergone surgery for tracheal reconstruction. The tracheal T-tube helps prevent the airway from collapsing while the trachea heals. Tracheal T-tubes may also be used when there's trauma to the larynx or trachea. And lastly, a tracheal T-tube may also be used as a substitution for a tracheostomy tube in select individuals. A tracheal T-tube is usually inserted surgically. A hole is created in the trachea. The tracheal T-tube is bent and inserted with a forceps into the trachea. If the tracheal T-tube needs to be changed out, the patient will have to undergo another procedure to place a new tracheal T-tube. If the tracheal T-tube is accidentally pulled out, a tracheostomy tube should be inserted into the hole in the neck, and the patient will have to undergo a procedure to reinsert a tracheal T-tube. Please note, once a tracheal T-tube has been removed from the airway, it cannot be reinserted by the patient or caregiver. The tracheal T-tube does not require the use of tracheal ties to keep the tube in place. The tracheal T-tube provides support to the airway. With the cap placed over the outside limb, showering can be done safely without the risk of water entering the airway. Since the tracheal T-tube is intended to be used with the cap placed over the external opening, there is a low risk of developing a mucus plug. If mucus plugs the tracheal T-tube can be uncapped and a suction catheter can be inserted into the tracheal T-tube. Tracheal T-tubes are not intended to be used with a ventilator. Tracheal T-tubes are open at both ends. This means if a person uses a ventilator, some of the air will be directed up the airway and out the nose and mouth. Tracheal T-tubes do not have cuffs on them. They cannot be inflated or deflated. Thus, tracheal T-tubes cannot be used in a person who needs full respiratory support from a ventilator. If a person needs an artificial airway to breathe, the tracheal T-tube is not intended to be used with the cap off the outside limb. Removing the cap from the outside limb will cause mucus to accumulate and possibly block the tracheal T-tube. The tracheal T-tube does not have an inner cannula. If the tracheal T-tube becomes clogged with mucus, suctioning will need to be performed. If suctioning cannot clear the mucus plug, the tracheal T-tube must be removed and a tracheostomy tube inserted until another tracheal T-tube can surgically be inserted. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye!